Which is least likely cause hyperuricemia. Hyperuricemia, that means the increased urea level in the blood. And which is the least likely, that means which is not cause hyperuricemia, which is not cause of hyperuricemia. I have the options: severe psoriasis, Leishman syndrome, amiodarone, diabetic ketoacidosis, and alcohol. So first of all, let's see, this is the hyperuricemia. Increased level of hyperuricemia may cause secondary to when there increased cell turnover, where there is reduced renal excretion of the uric acid. Hyperuricemia may also be found in the asymptomatic patient. That means in the blood there is high level of urea and uric acid, but there is no clinical symptoms. Hyperuricemia may be associated with hyperlipidemia and hypertension. So hyperlipidemia, it may associated with the hyperlipidemia, that means the increased lipid content in the blood, and hypertension also. And sometimes it may be associated with the metabolic syndrome. Some important metabolic syndrome may also cause the hyperuricemia. Here the cause of the hyperuricemia, when there is increased secretion of the urea for any type of cause, such as in case of Leishman disease, myeloproliferative disorder, diet rich in purine, exercise, psoriasis, and cytotoxics. So these are the cause of increased synthesis of the urea in the body. Then some cause which decreases the excretion through the kidney. Among them, some important drugs such as the low dose aspirin, diuretics, pyrazinamide, and then preeclampsia, which is present in pregnancy, alcohol, renal failure, and lead. And one of the important mnemonic for hyperuricemia, which is the can't live. C for cyclosporin, A for alcohol, N for nicotinic acid, T for thiazide, L for loop diuretics, E for ethambutol, A for aspirin, and P for pyrazinamide. So these are the main cause of the hyperuricemia. Now, which is the least likely causes hyperuricemia, that means which is not cause of the hyperuricemia, this is the amiodarone. Other option here such as this severe psoriasis, Leishman syndrome, diabetic ketoacidosis, and alcohol, they causes